And Communications Director with the Committee to Protect Healthcare. We appreciate you being here today. I know it's a busy week. We are joined by physicians across Ohio who will share why it's critical for Congress to extend the enhanced ACA premium tax credits, both for their patients and for hundreds of thousands of Ohioans. Please note that the physicians speaking today are speaking as individuals and with the committee, not necessarily on behalf of any employers. So we respectfully ask that you only refer to them in any coverage as they introduce themselves on the call. And please do not include employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Romanos.
Good afternoon. Thank you for having me, and thanks to everyone for joining. My name is Dr. Catherine Romanos. I'm a family doctor, and I take care of patients in Columbus, Dayton, and Cincinnati. I'm joined by fellow physicians across Ohio today who are concerned about our patients as they face skyrocketing health insurance premiums. Over the weekend, open enrollment for the Affordable Care Act marketplace began, and many Ohioans got to see what their premiums will be for next year. The outlook hasn't been good. Many of my patients get their healthcare through the marketplace on healthcare.gov. And many of them qualify for the enhanced premium tax credits, which provide tax relief for hundreds of thousands of Ohioans, helping them afford premiums for their health coverage. Because President Trump and congressional Republicans' refusal to put people's health ahead of billionaires, there are 583,000 Ohioans currently enrolled in healthcare marketplace insurance plans who are now facing higher costs for their healthcare in 2026. The enhanced ACA premium tax credits, which were passed in 2021, now mean that 4 in 10 Ohioans pay $10 or less for healthcare premiums. Others are saving hundreds, even thousands of dollars a year in their healthcare premiums. Simply put, these tax credits have been making health coverage affordable for working families, especially as costs for groceries, rent, and pretty much everything else continue to rise. Nearly 600,000 Ohioans currently enrolled in healthcare marketplace insurance plans are counting on tax credits so they can afford healthcare, and they face significantly higher costs for that care next year. The Urban Institute estimates that 140,000 Ohio families will not be able to afford the health care they buy on the marketplace and could become uninsured. These folks are small business owners who buy their own health care, people who are self-employed, folks who don't get coverage through their workplace, and seniors who aren't old enough for Medicare, and many more. Instead of supporting Ohio families and the doctors who care for them, Ohio Senator John Husted has repeatedly backed Trump and Republican plans to take healthcare away from people. Ohio Senator Bernie Moreno goes into hiding every time someone asks him whether he'll support relief for middle-class Ohioans who buy their healthcare. And Ohio's Republican members of Congress are taking people's health care away and holding their health and well-being hostage so they can continue giving trillion-dollar tax breaks to billionaires who already have more than enough. Today, physicians are standing up and telling our members of Congress to stand up for our patients. Thank you. Now, I'd like to introduce Dr. Brogan to speak.
Hi, everybody. My name is Dr. Kara Brogan. I'm a practicing OBGYN here in Columbus, and I work at a federally qualified health center. As physicians, we see firsthand how access to healthcare improves health and saves lives. An insured patient who has diabetes is more likely to manage that chronic condition better, see a doctor regularly, get access to appropriate treatment, and take their medications as prescribed. Take away that healthcare, and that same patient is likely to stop seeing a doctor or delay their care, even stop taking their medications, which can cause their disease to progress and damage vital organs necessary for an active and healthy life. With access to healthcare, a patient who experiences chest pain is more likely to see a doctor immediately rather than delaying care because they're afraid of the financial consequences of a large medical bill. As an OBGYN, I see every day how people who have health coverage are more likely to better manage their chronic conditions, get care early enough to affect positive change, and stay healthy so that they can work and care for their families. Simply put, access to affordable health coverage helps people stay healthier, be productive, and live more rewarding lives. By refusing to extend tax credits for hundreds of thousands of Ohioans who get their health care through the marketplace, politicians in Washington will make healthcare unaffordable for working families. How unaffordable? A 60-year-old couple in Ohio with an income of $82,000 will have to pay $15,000 more for their healthcare premiums next year. That's over $1,000 a month. A middle-class family of four with a household income of $126,000 will be forced to pay $6,200 more for their healthcare premiums. Adding thousands of dollars to people's healthcare premiums in 2026 will worsen the financial strain so many Ohio families already feel at a time when everything, from the grocery store to safe housing, already feels too high. Our patients share their stories with us all the time, and many of them are terrified that they will lose their health care because President Trump and congressional Republicans are making health care unaffordable and even taking away their health care. They're worried about how they'll manage a disease or recover from an injury or protect their children and their loved ones. Ohioans are worried that a single medical emergency will ruin them financially, destroying everything that they worked so hard for, from losing their hard-earned savings to losing their homes. President Trump and congressional Republicans should work across the aisle to extend the ACA tax credits to folks who buy their own health care and protect health care for low-income Ohioans. Thank you, and now I'll turn it over to Dr. Smith.
Good, thank you. So I'm Dr. Doug Smith. I am a community psychiatrist in the Akron, Ohio area. And furthering our sentiments here, as physicians, we're deeply concerned about our patients losing their health care coverage. President Trump's big reconciliation bill, which congressional Republicans supported, already cuts an amazing $1.1 trillion in Medicaid. These Medicaid cuts already threaten to take health care away from 770,000 Ohioans, the overwhelming majority of them working Americans in low-paying jobs who actually count on Medicaid to be healthy, which of course overall saves our country healthcare costs. Not only are Republicans throwing people off their health care, they're also throwing people out of work. The overwhelming majority of them are working Americans, and the elimination of about 28,000 jobs in healthcare, as well as thousands of additional jobs, such as construction and the service industry. So it's not just healthcare that we're talking about. Hundreds of thousands of working middle-class families are at risk of going uninsured because the congressional Republicans are taking away these tax credits that make healthcare premiums more affordable, or perhaps just affordable, because they're not affordable at all for some people without these. Families are already facing higher costs when they buy food and they pay the rent, and they simply can't afford then to pay thousands of dollars more every year for their healthcare premiums. We hear the patients, they tell us directly as physicians, worry about whether they can put food on the table or even pay for the utilities, which is very important as we're moving into the winter season here in Ohio, because the rising healthcare costs will simply blow a hole in their budgets. Current ongoing concerns about housing insecurity and food insecurity, such as the loss of SNAP benefits, only compound this healthcare issue. No family should have to choose between putting food on the table or taking their child to the doctor. And this is the choice that President Trump and Washington Republicans are forcing families across Ohio to make. The growing numbers of uninsured people will also strain Ohio's healthcare system. These individuals are still going to seek care, likely only in a crisis, only in tertiary care and emergency department, the most expensive way to achieve that, which does not help other Ohioans or the economy. When people lose health care, they kickstart a cascade of disasters that affect all of us. We're already hearing about 11 rural hospitals across Ohio that are in danger of closing because of those $1.1 trillion cuts in Medicaid. Tens of thousands of Ohioans are at risk of losing their jobs because of the ripple effects of a financially strained healthcare system and these hospital units that are closing. When people lose their jobs, they will also likely lose their health care, and cuts to Medicaid and unaffordable healthcare premiums will further drive up the numbers of uninsured people, increasing costs and further straining the remaining hospitals. Ohioans will be sicker, poorer, and less secure because of the attacks on healthcare from President Trump and congressional Republicans such as Senators Moreno and Husted. Physicians stand with our fellow Ohioans in calling on politicians to set politics aside, put people first, and make healthcare affordable and accessible for all Ohioans. Thank you. Now I'll introduce Dr. Barr.
Hello, thank you for having me here today. I'm Dr. Laurel Barr. I'm an emergency physician who practices in the Central Ohio area. I would like to start with this thought. If you hate Obamacare, but you like the ACA, what you hate is partisan political messaging, and what you like is a thought out, funded, and implemented plan to make healthcare more affordable and accessible to everyday Americans, especially those unable to access health insurance through their employers, those with pre-existing conditions, and those wishing that the screening exams, tests, and procedures recommended by their doctors to keep them healthy would just be covered by these insurance plans. Obamacare and the ACA are one and the same. Today, the funding that allows these plans to be affordable and accessible to everyday Americans is at stake, and without any other proposals to fund healthcare that saves lives. When our broken healthcare system fails Americans, they often turn to the emergency department for help. As an emergency physician, if you need my help, I will see you for anything at any time. It's an unfunded mandate and a badge of honor. All the healthcare providers I work with will care for you, your friends, and your families on days, nights, weekends, holidays, and we're all just trying to deliver effective, life-saving, compassionate care. But today, that's increasingly more difficult to do that. We all know that our healthcare system is far from perfect. Before the Affordable Care Act, it was common to see patients who had insurance, but whose chronic conditions such as diabetes weren't covered. After the ACA, rarely do I encounter patients who lack coverage due to pre-existing conditions, but I commonly see patients who make hard choices about their health every day because they cannot access or afford the medications and healthcare interventions that will keep them healthy and alive. Simply choosing not to fund the existing system without offering any alternative is not just irresponsible, it's deadly. Open enrollment for healthcare insurance plans on the ACA marketplace started Saturday. An analysis found that average persons buying health insurance plans on the ACA marketplace will not only be paying higher premiums, but they'll also be paying 75% more for their out-of-pocket premiums. Families are already having to make tight budget choices every day. Now they'll have to decide whether they can afford to pay hundreds, even thousands more dollars every year for healthcare coverage. Many will decide they can't, so they'll just go without. I see patients who aren't making these choices irresponsibly. It's often a choice between making insurance payments or paying for rent and becoming homeless, paying for transportation to get to work, or buying food for their children. These are not easy choices. It's a gamble. But I see those people when their gamble doesn't pay off. I see young people having heart attacks and strokes that would have been prevented if they were able to afford their blood pressure medications. I see patients in diabetic crisis way too frequently because they can't afford their insulin. I see patients who have nowhere else to go just to access a sandwich. In many cases, their emergencies, crisis, severe complications, and disability could have been prevented by access to affordable health care. Some people arrive too late, and I can't save them. But for those who survive, their care is more expensive than if they had had access to preventable and affordable medications, ultimately making healthcare cuts now more expensive in the future. Daily routine insulin or blood pressure medications are less expensive than multiple day ICU stays with IV medication titration, intense monitoring, and invasive procedures. And at the end of the admission, they still need those medications or they will be back having the medical emergency again. This affects everyone. I cannot see patients to see if their ankle is broken in a timely manner if I'm busy saving someone's life, even if the person with the ankle pain can afford insurance. It might also take me longer to see you and diagnose your heart attack when I'm actively trying to stop someone from dying. More uninsured patients mean increased uncompensated care, which will affect everybody in the form of longer waits, longer boarding times, meaning when you're sick enough to the hospital or to need the hospital, you need to wait sometimes days for a bed. When no insurance pays for this care, the patient is unable to pay. It results in increased staffing cuts across the hospital. And this makes the problem worse if the hospital is able to stay open. Each of these things directly translates to worse patient outcomes, worse long-term health, and increased mortality. People aren't going to stop getting sick or injured, but without affordable health insurance, more people will go without primary care or will stop taking medications they cannot afford. They won't have care for their minor medical conditions when they are minor until they are emergencies, which are more costly to treat than prevent and can leave people with irreversible consequences. The Congressional Budget Office estimated that without healthcare tax credits, an additional 4.2 million people will lose their health insurance because costs will rise to an unaffordable level. The Kaiser Family Foundation estimates that up to 460,000 Ohioans altogether will be uninsured due to Medicaid cuts and refusal to extend the ACA tax credits. Physicians across Ohio are extremely concerned about our patients losing access to healthcare that can improve health and save lives. While politicians fail to reach any agreement, the long-term consequences of preventing patients, including middle-class Ohioans, from accessing affordable healthcare will be devastating. We urge Ohio's congressional delegation and President Trump to put people ahead of politics and protect Ohioans' access to affordable healthcare. It's not too late to reverse the Medicaid cuts. It's not too late to extend the ACA tax credits. But every day matters. Our elected leaders need to put the health and well-being of Ohioans first and extend the ACA tax credits without delay. Thank you.
Thank you so much. Excuse me, Dr. Barr. Thank you, Dr. Smith, Dr. Brogan, and Dr. Romanos. We will now open it up for questions for any or all of the physicians. If you have a question, the easiest way to ask is if you could please type it either in the Q&A or in the chat box, and then I can help filter through the questions. So I'll allow a couple moments for folks to be able to type those questions. In the meantime, I also wanted to mention that we are recording this, and I will be happy to share a copy of the recording with you. I know a couple of you have already asked for that, so I'll be sharing that as soon as I can after the call is concluded. Okay, I had a question chatted to me. I'm going to put it in the chat box for you all to see as well. Elections in other states yesterday seemed to indicate that voters are concerned about affordability issues. Do you think your patients will consider these ACA tax credits when they vote next year? That's for anyone.
Yes, is the short answer.
I would say I hope so. There are so many insults coming at struggling families every day. Cuts in SNAP, cuts to healthcare, housing troubles. I worry that people are just so overwhelmed that they can't keep track, or that people will be so disenfranchised by the election next year that they won't be able to vote, or their life circumstances will be so impoverished that they can't vote.
Yeah, I'll actually add to that. I mean, from the psychiatry point of view, from community psychiatry, a lot of the individuals that I see and similar professionals to me see, they're already at a huge disadvantage. Cognitive issues, mental issues, emotional issues, substance use issues. They're the ones who have already fallen off Medicaid at times because they just couldn't complete the paperwork in the timely fashion. So I agree, those individuals are really at high risk. Then you add to that all the other stressors that are going on right now and the really fear mongering and so forth that goes on. And I think some of them will not actually be able to even get to the voting box or do the paperwork. And I think that's a huge problem. I think we're furthering the disenfranchising of this large group of people. It's not a small group. During COVID, we saw numbers as high as 1 in 3 individuals with a diagnosable mental illness. from some of the studies. It's a lot of people. It's not the stigmatized tiny group that we talked about 30 years ago. So I really do think it's a huge issue that we need to make sure everybody has a fair chance to share their opinion, give their vote, and not be hampered by hurdles that are just impossible for somebody with some of these illnesses.
Thank you, and thanks for the question. Another question, this one's in the Q&A from Haley. You've alluded to this a little, but what are the ripple effects for the healthcare system in general when people opt to go uninsured? That's for anyone. I'll read it again. You've alluded to this a little, but what are the ripple effects for the healthcare system in general when people opt to go uninsured?
I think Dr. Barr started this with her excellent remarks, and I'll hand it back to her because she unmuted as well. But I mean, ultimately, preventive care is the cheapest care, right? So if we can learn to take care of ourselves and do the right things that science tells us to do, we're less likely to end up needing secondary care or, more importantly, tertiary care, which often means surgery, hospital, emergency department, not necessarily in that order. And that's the most expensive version of care. So to the extent that we're taking away health care, the only option, and we hear about stories of this, where a mother or father will sit in the parking lot of an emergency room hoping their child turns the corner and feels better so they don't have to go into the emergency department and pay the copays and pay the other fees if they don't have insurance at all, pay the full boat rack rate, as they call it. And that's just impossible. Right? That's horrible to imagine. You're sitting there waiting to see if your child feels better enough that you can take the risk of going home and hoping that they make it through the night. I'll hand that off to Dr. Barber. That's what we're forcing people to make those types of horrible decisions.
I can speak to the general sense that we get taking care of pregnant women, which is that, we have patients who are already struggling to get appointments to be seen. They're delaying their care. They're coming to us well past, when we typically like to see patients come in for their routine prenatal care. And so we're missing a lot of opportunities to do the smoking cessation, the diabetic counseling, teaching, checking blood pressure. And all that does is, it creates a sicker population. And we know that our maternal morbidity and mortality rates here in the United States are pitiful. This is only going to get worse as more and more women are uninsured. They're already struggling with. I just had a patient a couple days ago who said, I can't afford my ultrasounds. I get specialty ultrasounds for my high risk pregnancy and I can't afford it. So should I skip them? And I don't really know what to tell this patient. These are really difficult situations that the patients are in. And they tend to feel a lot of guilt that they're choosing, the financial hardship over their pregnancy or their children. And it's just upsetting to see on the ground. We're taking care of these patients all day long. And many times I think we all feel like we're social workers because we're just trying to help patients navigate a healthcare system that is actively working against them.
Those are all really excellent points. And I apologize. I forgot what the original question was because I had something to say about it. Could you repeat the question, Anika?
Yeah, absolutely. You've alluded to this a little, but what are the ripple effects for the healthcare system in general when people opt to go uninsured?
So I see it a lot in the emergency department because the emergency department has become the unfunded safety net of really the US in general. And because of the financial strain of this, a lot of rural hospitals who don't make up that money just close. Other hospitals make decisions to um, offer services that are more in line with their interests. And um, the patients who don't have anywhere to go often go to the emergency department because of an unfunded law called EMTALA. And that law was passed in the 1980s. It's the Emergency Medical Transfer and Active Labor Act. And that law was passed in response to, among many of other things, patients arriving at county hospitals with IVs in place from other hospitals and gunshot wounds to their chest where they didn't get care once they didn't have any insurance or ability to pay. But this law was passed without any funding behind it. So that's the reason why I went into emergency medicine, because this is the one place where if you want to see me, we don't first ask what your insurance is. If you go to make any other doctor's appointment, it's going to be what's your name, what do you need to see us for, and what's your insurance. And if they do not take it, then it may be a hard stop, or it might be before you can go and make an appointment, you have to talk to someone from financial. I don't want to do that. I want to care for people. So I don't care. And there are systems in place through the hospitals and through public funding where I can do that because it's the right thing to do. And everybody who's on the ground caring for patients and looking them in the eye and sees the effects of all these cuts, that's what we want to do. And we want to be able to continue to do that. But when more and more patients arrive without any way to pay for their care, and when they don't get preventative care, they're sicker, they're in often avoidable emergencies if they had just gotten that care. They've had their cancer wait too long to be diagnosed, and then it's end stage. I mean, these are things that I see every day that are entirely preventable if the patients could access the care that they need outside of the emergency department. So we already see this where patients lack care otherwise through accessibility or through affordability or through a number of different things. And it's straining the system. And there's been a number of hospitals that have closed in the last 10, 20 years. And we're worried about more hospitals closing because when they close, we can't deliver that care. There's no systems in place for us to do that. And then when you need emergency care, you have to travel longer distances and it's riskier. And then you get that care sometimes delayed. And emergency departments are already just full. We have way longer wait times than we used to. We have people boarding. We have people in the emergency department who are waiting for beds in the hospital that aren't staffed. So there's no nurses to take care of them. So we're already seeing those effects. And if we cut funding to this extent so fast, so quickly, it's going to get a lot worse. And I would rather not see what that's going to look like.
I'll just add one more piece because I didn't catch it, excuse me, until you read the question a second time. I think it's a horrible question that we have to even question who would opt to not having healthcare insurance. Nobody opts to not have healthcare insurance. They only opt to do that because they can't afford it. That's not an option. That's just an impossibility. So I think this idea that we're giving people a choice. Oh, you can choose to go without food and housing, but have healthcare insurance versus not opting, in quotes, to not have. I just think that I want to point that out. I mean, that's a horrible statement in a country that is not high on the list of healthcare outcomes. And Dr. Brogan mentioned that a little bit with infant mortality, which we certainly have a big problem with in Akron, Ohio as well. But I don't know the exact numbers, but we're like the 50th country in the world in the rankings for healthcare outcomes. I don't think most Americans or Ohioans realize that. We assume we have the best healthcare in the world. We're like 50th. We're on par, and nothing against them, but we're on par with like Turkey, which has way less money in their healthcare system. And I don't think people realize that what we're talking about is taking us from a ranking of 50th, which includes things like infant mortality. Our longevity is far from the longest in the world in terms of lifespan. And we're now adding to this burden by having people who can't afford healthcare insurance, which is what we do. Are we trying to get to 70th in the world? I mean, I would love to see us, move up the ranks and get closer to number one. I know we already spend twice as much as the per person in this country as the next country, which I think is France. It may have changed since I looked at the numbers. So again, I just put this added context that we're talking about this as though it's some kind of a choice, as though, oh, don't worry about it, you'll still get phenomenal care. We may be the best at tertiary care in the world with all of our fancy equipment and stuff, but that's only because we've been forced to be innovative there because we keep allowing people, in quotes, to opt out of healthcare insurance. That's just unconscionable to anybody who likes to care for people, including obviously physicians.
And I'd just like to add to that we have highly trained professionals. We have highly trained healthcare professionals. We have advanced equipment. We have the latest technologies. But what we don't have is access to those in a fair and equitable way for everybody. So the reason our healthcare system is not the best is because frankly people can't access it. If you can get to me, I'm happy to prepare. I'm happy to give you my best care, and that's what I want to do. But if you can't get to me because you're in the parking lot because you're afraid of the bill, then you're not going to get that care. And if you do, it's going to be later, and that might make the difference between life and death.
I'll say too that when patients don't have health insurance and they come to us sicker, they take more time. And there's only so many human resources to take care of those sick patients and everybody else. And taking care of sick patients is more taxing, it's more time consuming. And healthcare workers are struggling and not wanting to continue on in this work because they're being forced to take care of preventable situations. And similarly, it's hard to recruit and retain smart, vibrant young people who want to work in healthcare in Ohio. I teach medical students and residents, and routinely we have a conversation. Well, why don't I just go and practice in a state where everyone is insured, or it's a lot easier to get people access to medications? It's so hard here. And so we need to make it doable to take care of people here so that we can take care of people, but so that we can train other people to stay here and take care of people.
I'd like to add to, I have this unique experience of working in a federally qualified health center, and we are essentially a safety net for the preventative care, and we get a lot of referrals from the ER for patients that don't have insurance. But we are a business, we have to keep our doors open, and we do rely on Medicaid and commercial insured patients to bring us the revenue so that we can continue caring for a very large population of uninsured patients that we see. And we provide excellent quality care that these patients would otherwise not be able to get. And, we're having to have really tough conversations where we discuss, how do we keep our doors open and take care of these sick patients? And take care of these pregnant patients and see them for their behavioral health needs, when we know that in less than a year, we're going to have a substantially smaller group of patients who have Medicaid. And then on top of that, these patients who, we have about 20% of commercially insured patients, and many of those get their insurance through the marketplace. And if they are not able to get their insurance on the marketplace, they become uninsured, and we still see them. But how do we see them keep our lights on, pay everybody within the business and still provide quality of care and keep our physicians and nurse practitioners from not wanting to leave? Because as Dr. Romanos mentioned, it comes with an emotional tax that the providers are paying with this. We're walking into these rooms and we're taking on all of these extra burdens in addition to trying to manage their chronic conditions. And so I think what we're going to see is just an overburdened, overtaxed system, and potentially providers, leaving and finding other work that is not as emotionally taxing for them.
Absolutely. Thank you all. It's clear that you are very caring and passionate about your patients, and not just them, but all Ohioans and your fellow Americans as well. So thank you for taking the time on top of your already very busy schedules to advocate for them and advocate for extending the ACA tax credits to help more people hopefully retain their health care next year. I am not seeing any other questions, so we'll go ahead and conclude today's call. Thank you so much to the members of the media who joined. We appreciate you being here. Again, if you reached out or do reach out for the recording, I'll send that to you as soon as I can. And thank you so much to our speakers, Dr. Brogan, Dr. Romanos, Dr. Barr, and Dr. Smith. We really appreciate your time and advocacy, and hope you have a good rest of the day.
Thank you.
Thanks, everyone.
Thank you, guys.
Thank you.